In using population health as an approach, we want to try and target the triple aim of healthcare, and we can do that by effectively identifying priority population cohorts around whom we want to design integrated models of care with partners from the local authority and the voluntary sector. By, for example, doing that around a model of anticipatory care and anticipatory care services, we can use population health analytics and risk stratification to identify those patients or residents that have the highest risk or probability of an adverse health event happening in the near future, and ensure that we can proactively target support around them. So where, for example, that has allowed us in parts of our system, like in East Surrey, where they've used population health analytics to identify those at a highest risk of an emergency admission in the coming year, we can use that to review that cohort and to ensure that we are already doing everything that we can for them. So, for example, it has allowed us to identify a part of that cohort who previously hadn't been referred to frailty services, and for one primary care network in particular, about 2 in 5 of the residents that they identified using that tool have been previously unknown to their frailty care services. So that allows an intervention which ultimately was able to improve or support the improvement of health and well-being for that part of the population that might have otherwise not been offered that service. It improved the experience of care for those residents in that they were being proactively offered a service that will hopefully help them live independently for longer, rather than waiting until they're in crisis and responding to it. And finally, it ensures that we use our resources most effectively by targeting them at the parts of the population that is in the greatest need or will have the most to benefit from whatever intervention it is that we've designed, like I said, in this case around anticipatory care and frailty services for older people.